Greetings, all you incredible 2030 folks out there. I am pumped today. I'm always pumped when I have like behind the veil knowledge, right? Like I always feel like I'm like all that when I'm like, I know something you don't know. And then of course, we know my personality that I have to like ooze it all over everybody because I can't keep it to myself. Today is one of those times. Now, I'm going to give you like a basic introduction of my friend Tyler, and he's going to run with an incredible knowledge share during our time together today. So here's my basic introduction. We said when we promoted this class that how you brush your teeth could speed up your weight loss and your health improvement. I'm going to go ahead and pull back the veil. Oh, it's interesting. I've got like curtains here in the room that I'm recording in today. I could actually like pull them back if I really wanted to be dramatic, right? I'm going to pull back the veil and go ahead and give you the punchline right out of the gate. The punchline is this: the way you brush your teeth could result in creating a very uneasy environment in your body because of bacteria. It's really all about bacteria. That's the bad guy. The bad guy is bacteria. So the way you take care of your teeth can result in an extremely uneasy environment in your body. What does an uneasy environment in your body create? Slow metabolic rate, heart issues, even insulin issues, organ issues, tissue damage, the inability to process or digestion, acid reflux, IBS. I can go on and on and on. Bacteria is a bad guy. So if you take care of your teeth incorrectly or not optimally, you're going to create this environment of no ease in the body. You may have heard it referred to as dis-ease, disease. Now, the thing is, when we feel all stuffed up, we know we have disease, right? If we're achy, we know we have disease. If we have a headache, we know we have disease. There are all these signs and symptoms we look for that tell us we have disease. Well, you may not realize two things. Sometimes those signs are internal and you don't feel them yet. Sometimes they show up in the gum area with a sensation that isn't good. And what you also may not realize is that dis-ease, because the bad guy bacteria, will literally slow down weight loss results and not only impair health improvement, but cause further health issues. So see, it all comes back to the ease environment or the dis-ease environment. It all comes back to the bad guy bacteria. When you take care of your teeth correctly, and you take care of that bad guy bacteria, that dis-ease environment settles down, the metabolic rate works better, weight loss is more optimal, and it all works together. It's amazing how God put this body together, right? We are really a whole body. Everything is connected to everything else. So with that introduction, my friend Tyler, I'm going to let you introduce yourself and just kind of take it from there. And then, as I said earlier, we'll go back to a super simple basic after you just introduce the way, however you want to introduce from what I just shared.
After we just let it rip here. Okay. Yeah. Well, I appreciate being here. This is exciting. I'm already taking notes, just having these conversations. I always learn things and brings things back to life. So thanks, Donna, for having me on. And I'm excited to share this topic. I'm really passionate about it. I have two practices. I have a dental practice where we focus on the connection between oral and systemic health. So I hope to share some of that today. And then also I have a sleep practice where we help people with disorders of sleep apnea and snoring and problems with relationships too, because if you're not sleeping well, your significant other probably isn't sleeping well, and they're letting you know about it. So hopefully I've got 8 or 9 things here. Depending on what we have time for, we'll see what we can cover here. But I love the point you brought up of the dis-ease, because our mouth's the gateway to our body. So many things are linked and connected. And unfortunately, because we're living longer, we're keeping our teeth longer, we're doing more Zoom videos, Facebook Live, just like this. We're all looking at our teeth more. You know, during the pandemic, it was interesting because we had such a surge in different ways of people who wanted to get their smile restored and renewed. And I think a lot of it was, you know, even during times of masks, we would be on videos and people get close and they start seeing their teeth, or, you know, there, so many people have said, oh, my kids or my grandkids were like, why your teeth look kind of yellow, or what is, you know, it looks like you got a chipped tooth or something, you know. And it's amazing how kids are so blunt and honest, but people are really, really looking at their teeth and smile. So today, unfortunately, brushing alone is no longer enough to keep our teeth. And we'll get into that, but I'm going to share with you some of the secrets and things that dentists and hygienists do for their own smiles that you may not be aware of. And hopefully we can share some things that will help you not only with better breath and a nicer smile, but helping you with all the cool things Donna's sharing with you about your total health and wellness and just feeling better about your life. So the first thing that we'd like to share is the rule of twos. Okay, so the rule of twos is 2, 2, and 20. All right, so brushing your teeth twice a day. Most people know that. 3 times a day is okay too. Just don't brush too hard. When you brush too hard, it will cause your gums to recede, and receded gums expose these soft parts on your teeth that are sticky, and plaque sticks to those, and plaque is bacteria. Bacteria causes inflammation. Now, our mouth has millions and millions, sometimes billions of bacteria. A lot of those bacteria are good. So we don't even love using things like Listerine and Scope and those mouthwashes too much, because the alcohol kills bacteria. It's not selective. It doesn't just kill the bad bacteria, it kills the good bacteria too. You want the good bacteria. So I'm not saying to never use those. They're good if you're being treated for gingivitis or you have a sore or cut in your mouth. But like antibiotics, there's probably a point where it's overused too much. So you don't want to just be killing all the bacteria. You want to just feed the good ones, and you want to get rid of the bad ones. So brushing twice a day. Don't brush too hard. You can brush 3 times a day. The second one is you want to brush for 2 minutes. So we love the electric brushes. The nice, you know, ones are usually at least 80 or $100 rechargeable. A lot of them now have sensors so that if you push too hard, they'll flash a red light or they'll turn off. Again, to help so that you're not rubbing your gums too hard, causing them to recede, which can cause other issues. So 2 minutes. The other thing I love about the electric brushes is they have a timer in them, so you can't cheat, right? A lot of times 2 minutes in our mind is really about 27 seconds. We're like, I gotta go. I'm too busy. You know, I gotta get out of here. So that helps. I teach my patients to hold their toothbrush like a pen, not like a hammer. If you hold it like a hammer, you're probably going to hammer away your gums and hammer away your enamel. So, you know, hold it like a pen. Enamel's very hard. It's smooth. It's like glass. It just needs to be massaged. So don't brush too hard. So that's the second two. The third one is 20 minutes. And what I mean by 20 minutes is after you brush, you don't want to eat, you don't want to drink, you don't want to rinse for 20 minutes whenever possible, because your toothpaste is filled with tons of good minerals and vitamins. And depending on what kind of toothpaste you use, you have fluoride and xylitol. Some of them have calcium. Some of them have herbal things like, you know, aloe vera. But you want to leave that coating on your teeth for 20 minutes. And it's almost like a miniature visit of going to the dentist when you have a mineral varnish put on your teeth. You can get a little bit of that at home each day. It also helps with sensitivity a lot. So when I brush my teeth, I brush it last. When I'm using a mouth rinse, I use kind of a like a xylitol mouth rinse. I'll typically use that first, or when I wake up, you know, zap that morning breath. Again, I'm not using a heavy alcohol rinse because I'm not trying to kill everything in my mouth. I'm just trying to put xylitol in there, which nourishes the good bacteria and it pushes the pause button on the bad bacteria. And then I'll brush after I rinse, and then 20 minutes, no eating, drinking, leaves that mineral film on there, which really helps. The second one is water. I'm sure Donna shares this with you a lot, being hydrated, drinking clear fluids, but we just don't drink enough water because there's too many other tasty beverages around us all the time, and they're in our face. But drinking water helps. When you have an acid attack on your teeth, for example, you eat something sweet, you eat something starchy, you eat something acidic. This includes a lot of healthy foods. You can eat an orange, like an apple, even sometimes the vegetables, right? There's some acidity in there. Well, that acidity can stay on your teeth for up to an hour. So when you have these constant acid challenges in your mouth, it starts to dissolve and weaken your enamel and cause sensitivity and cause yellowing and discoloration. So when drinking water helps buffer or wash away that acid faster, and it might cut it down by 3 or 4 times. So maybe instead of having an hour of acid on your teeth or 30 minutes, you might only have 10 or 15 minutes of acid, which really helps a lot, because then your teeth aren't coated in acid. Because I'm a dentist and I'm weird and I like looking at mouths, which many people hate going to the dentist, let alone looking in someone else's mouth. I kept my wisdom teeth when I had them removed. So they were perfect teeth, no cavities, anything like that. I soaked them in different drinks to see what would dissolve them the fastest. And the Mountain Dew and Coke were pretty equivalent. A close second, though, was G2, which was low-calorie Gatorade. All right. So the regular Gatorade's probably worse than Coke and Mountain Dew sometimes. But within a week, my teeth were just like, there was like powder that had come out of the teeth. Basically, all the calcium had been leached out just by being soaked in these drinks for a week. Now, your mouth's not going to be soaked in an energy drink for 7 continuous days. But if you do, a small amount a day over years and years, it can be really damaging. So I'm not going to say never drink those things. All right. I call myself a social drinker. It means when I drink soda pop or these drinks around people just to try to be cool at parties or weddings or whatever. All right. But I don't do it all the time. All right. I don't do it all the time. All right. I'm not going to strip away all the fun of your life.
All right, so let me interject a few really amazing things that we've already got.
Yeah.
Let's talk a little bit more about good bacteria, bad bacteria. I love that you've shared xylitol and that you're sharing first thing in the morning, get up and do this, right? And then brush and love that the new electric toothbrushes have you're pressing too hard. Love the hammer versus pen thing. That's amazing. But all of this is about good bacteria, bad bacteria. And even with plaque, which is amazing to learn that if you brush your teeth too hard, the gum recedes and up there it's stickier. And now the plaque has an easier place to adhere to, right? Okay, I want to go to a really, 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 I'm talking mega basic. Okay. So good bacteria, bad bacteria, differentiation, but also, and this is going to be so rudimentary to you, but also just plaque in general. Several years ago, John and I, my husband and I, it always falls that he and I end up at the dentist like within 2 weeks of each other somehow. It just always falls that way. And we're really busy people. We are very proud of the fact that we've had a very long lasting marriage, and we believe it's because we're interdependent. We're not independent. We're not dependent, right? We don't want to live and function without each other, but we're not totally dependent upon each other to function. We're very interdependent, very healthy. So I think that's why we end up at the dentist within a couple of weeks of each other. And neither one of us ever knows we've been to the dentist. Well, somehow that evening's conversation was centered around Gordon. Gordon is our dentist. And he said, "Did Gordon tell you about the 5-year guy?" I go, "No, what are you talking about, the 5-year guy?" He goes, "He told me today that he's got a patient who hadn't been to see him for 5 years. Okay, now I'm going like, all right, people are busy. Like I could get it. You're just busy, right? If you're not having any problems, right? But in that 5 years, he'd not brushed his teeth for 5 years. So let's have you, the expert, talk about good bacteria, bad bacteria, plaque, and just the value of brushing your teeth.
Well, let's talk about, I can guarantee you that guy had not had a date in 5 years and a day to start. But second, I've had people like that. One time I had a friend of mine, tall, dark, and handsome, known him since high school. He comes in and goes, "Hey, I think I set the record for cavities at my last dentist." Okay. So I had just graduated dental school, moved back, and this guy's like handsome, he's like a lady killer, just he's a magnet. Okay.
You were jealous.
But
You were jealous. Just say it.
I was jealous. Exactly what happened, okay. I got lost in his eyes and I didn't know what to do. Okay. My wife was getting jealous, right? But he comes in and he had like 15 cavities, and I'm like, "Hey, how often do you brush your teeth?" It's like, probably once or twice a week. And I'm thinking, how does your wife put up with that? It's just amazing, and there are a whole host of reasons people don't, but when one other thing I was going to mention on that, the good versus bad and the plaque. Okay, we talked about plaque on the teeth. Another place is the tongue. All right, our tongue's literally a sponge for bacteria. I didn't mention this. What I was going to is use a tongue scraper. All right, because you'll have less plaque on your teeth and in your mouth. If you use a tongue scraper, especially in the morning, it's amazing what you will see come off that thing. You can buy these really cool ones. You can buy them online for just a couple bucks, and they're copper. And copper is naturally antibacterial, but you use it on your tongue. It's almost like a squeegee, and you'll see this white and yellow foam just coming off there in the morning. And some people have said that's actually lymphatic drainage and kind of your body releasing toxins, but you'll taste foods better. Your mouth will just feel fresher. You'll have better breath, but it helps keep the plaque from getting on your teeth. And 5 years of not brushing, you're going to have a lot of inflammation in there, which now is being more and more linked with heart disease and diabetes. So there are actually studies showing that if you have plaque on your teeth that stays there and it gets in your gums, it will actually cause your arteries to start to harden, which is pretty bad. And to put that in perspective, I remember in my anatomy class in dental school, we were doing we were dissecting cadavers. And I won't show any pictures because I don't want to scare anybody. Okay, but I remember this cadaver. We took the aorta out of the cadaver, okay, which is the big blood vessel to your heart. And I remember the professor showing us it was crunchy, right? I mean, literally, you think a blood vessel is soft like a hose. It was crunchy. And I remember him saying, by the time you're 25, it's about 2/3 hardened with plaque, okay, which the plaque that's in your heart is very linked to the plaque in your mouth, but this had hardened. Okay, it almost made it like crunchy. All right, so if you think about that in terms of this big pipe, by the time we're 25, it's 2/3 blocked. We only have 1/3 of it open. So what we do with our health and the things Donna's sharing with you, the things we're talking about today with your mouth, is so crucial, because that remaining third has to be with us the rest of our life. And we've got to do the right kind of things to keep plaque from getting in there. So a tongue scraper is great. We also like the irrigators, like a water pick, an air floss, getting between your teeth. If you only brush and you don't floss, this is one of the things I was going to mention. If you don't floss, you're missing 1/3 of your tooth that's covered with plaque. Okay, so a lot of people say, yeah, I brush, I'm not very good at flossing. And I get it. Flossing's boring. I have retainers. I got braces as an adult. All right, I had train tracks as an adult and as a dentist just to put myself through that, so I would know what kind of torture my patients were going through, right? But I did that for a number of reasons, but I have retainers. They take more time to floss. There's nothing fun about it. But if you're only brushing, you're missing 1/3 of that plaque. Your brush cannot get to it. If you use a water pick and irrigator, it gets a little bit more. So if you'd only brush, I would say you're probably at a B- for your plaque control. All right, at best, B-. Just brush, maybe use mouth rinse, nothing else. If you floss and brush, takes you to an A. If you floss, brush, and use an irrigator, A+. So our patients who are the most at risk for medical conditions, diabetes, Alzheimer's, high blood pressure, we encourage them to do all of them, and we have some tools we give them. But our patients who want to just get a big improvement, if you're watching this and you're like, hey, I'm brushing my teeth, I'm always getting cavities at the dentist, I always feel like my breath's bad, or you think my teeth are yellow, there's probably inflammation in there you're not getting. So get an irrigator, get some string floss, and you'll have less of that plaque. Okay. Again, we're not trying to kill all the bacteria. We're just trying to disrupt or break up the bad ones so they can't camp out there too long where they start to find a new home and cause real problems. So hopefully that helps a little bit, Donna. Maybe is there any other points on that I didn't cover?
Yeah, I want to repeat something you just said, because you just made the point magnificently. And guys, this is what I want you to hear. There are signs. Well, actually, let me say what was just said, and then I'll go back to the sign. If you allow bacteria to camp out, good words, if you allow bacteria to camp out, okay, so now we're not just talking about on the teeth, okay, we're talking about the tongue, talking about in the mouth, which is why rinsing is good. If you allow bacteria to camp out in your mouth for too long, it's going to find a new home because it doesn't want to camp. Turns out bacteria doesn't like camping. Bacteria wants a long-term home. So it's not going to camp out. It's going to move on, looking for a long-term home. And here's the deal. If the bacteria is bad, the bad guy bacteria, the long-term home can be your heart. The long-term home can be your brain. The long-term home could be something as simple as lymph. But if your lymph can't drain, you've got a problem. So the reason I'm driving this home is obviously the dis-ease, right? The inflammation, the real problems, because I mean, we just mentioned 3 pretty heavy duty words. We mentioned Alzheimer's, we mentioned diabetes, we mentioned high blood pressure. And this is all coming from if I brush well or not, if I take good care of my mouth or not. So again, if we don't take care of our mouth correctly, the bacteria is not going to want to camp out. It's going to go looking for a long-term home. And if that bad bacteria makes a long-term home somewhere else in your body, it's going to cause long-term problems, the least of which is a slower metabolism and the inability to lose weight, or a very, very slow weight loss, which is what we talk about a lot here, but we're talking about much bigger issues. Now, the other thing that was said that I think I'm going to pose this as a question. Bad breath is a cue. Bad breath, you said, is a cue. Something's going on with the bad bacteria. We don't even so much, I guess, from here's what I'm hearing you say. We don't have to so much worry about the good bacteria, because the good bacteria is good. Let it do its thing, but let's control the bad bacteria. Let's eliminate that. One of the cues that I've got bad bacteria going on in my mouth is bad breath. What are the others, or are there others?
Yeah. So, I think about it like when I was in Boy Scouts, and I remember being taught, when you go to a campsite, you leave it better than what you found it. So a lot of my friends, they're appalled by bad breath. I don't know how you could do that. Okay. But for me, it's really fun to go, hey, this person has a problem, and I'm going to go in and make it at minimum as good, hopefully much better than the way we found it. And when there's certain bad breath smells you can get. You probably talked about this in some of your courses and things, but ketones it has a certain smell. When people are on certain diets now, they'll release more ketones. That's someone who knows what they're doing, and they're maybe intermittent fasting or controlling. That's to be expected to some degree, right? Morning breath, we're going to have some bad breath because we've been fasting. That's why it's called, break fast or breakfast. Been fasting all night, bad breath's going to be there. But then you have people who you know that they're not healthy or they're not intentionally doing that have that kind of breath. And there's a whole host of things, but a lot of studies now are showing that healthy mouth will reduce our overall medical expenses by 21% or more. So
Wow.
watching this, you've invested into Donna's program, knowing that there's some immediate gains, but also keep in mind that these things that she's sharing with you and the things we're going over with you today are going to decrease your medical expenses in the long term, right? I remember one of my friends sent a message a while ago. It was on like a group chat or something on social media. And it was like, hey, I pulled through the drive-through at Taco Bell and I ordered 100 tacos and it was only $14. I can't believe it's so cheap. And he was like, yeah, but they'll get you in medical bills later, right? Which is exactly what we're talking about here. And the CDC did a study. They said for every dollar spent in prevention in your mouth, you save $36 later. So if you're watching this and you're like, man, I'm getting all these, I always have problems at the dentist or the doctor, or whatever. Okay, go more frequently. A lot of people, 2 months, going to the dentist twice a year for checkups. There's really no science behind that. That came from Claude Hopkins, who is a very well-known marketer decades ago. He was promoting Pepsodent as the toothpaste. Many of you probably never even heard of Pepsodent. They have really old commercials. If you want a good laugh, you can look them up on YouTube. And there's some funny old commercials, but basically they were trying to sell mint toothpaste because before that, it was just original flavor, tastes like trash. If you ever had original flavor Listerine or toothpaste, I don't know what's in that, but it's not mint. And they're trying to get all these, World War II, the number one reason soldiers were sent home was mouth disease. They had cavities, toothaches, root canals. Only fewer than 9% of Americans had toothpaste in their medicine cabinet. If you're listening to this, that's probably blowing you away going, how could less than 1 out of 10 even have toothpaste in their household, right? Almost every household has toothpaste nowadays, but people weren't using it. Mouth disease was sending soldiers home. So they came up with this kind of jingle of, hey, brush your teeth twice a day with Pepsodent, see your dentist twice a year. Insurance companies adopted that. There's no science behind it. We have patients we see every month for plaque control. We have a lot of patients we see 3 or 4 times a year. So you need to talk with your dentist and customize your plan. Don't just go off of what your insurance covers or what everybody else is doing. Some people we do see twice a year, but you've got to customize that because you may need to go more frequently. If you're over 18, there's a 50% chance you have gum disease. If you're over 65, there's a 2/3 chance you have gum disease. And that's a big problem because we haven't gotten into that part yet, but the teeth plaque is even worse when it's in your gums because that's where the real systemic total health problems happen. Your mouth's red for a reason because there's so much blood supply between your shoulder and your head. There are so many arteries, so much blood circulation, mouth's red. So that bloodstream is so easy to get into. Plaque, I think we put in our mouth. Sometimes people will have bleeding gums and they'll be like, yeah, it bleeds a little bit when I floss or brush. It doesn't hurt. But if you just have a little bit of gum disease, a little bit of gingivitis, it's the equivalent of like your arm from your wrist to your elbow. If you were to peel all that skin off and it's bleeding, that's how much surface area in your mouth is disrupted from just a little bit of gingivitis or gum disease, and it just gets worse from there.
Okay, so again, let's go back. I'm going to stick with that word bacteria for a second because guys, so we said bad breath, right? Now we're talking about bleeding gums. Let me make sure I got these numbers right, Tyler. Oh, if you are over 18, 15% chance you have gum disease. If you're
50.
over 60,
50. If you're an adult, 50%. Yeah.
and if you're over
50% of adults.
65, it's 2/3. So it's 66%.
Correct.
Okay. So
Yes.
again, bacteria. So I this is going to feel like a rhetorical question, but I'm going to ask it nonetheless. Any kind of bleeding gum is no bueno, right? There should be no bleeding gums of any kind. No ifs, no ands, no buts, no maybes, right? Okay.
Yep.
So if your gums are bleeding when you floss, whether they hurt or not. So we already talked about bad breath. That's a sign. If your gums are bleeding when you floss, when you brush, whether they hurt or not, what I hear you saying, Tyler, is that's a sign, right? There's a problem. Okay.
Yes, I mean, if you very rarely have bleeding, maybe a potato chip poked the roof of your mouth, or you scrub too hard, that's okay. But if you're getting it more than a couple times a month, if you were washing your hands and you had this spot that kept bleeding every time you wash your hands, you'd be pretty concerned about that. Same concept.
Okay. So I'm going to go one step further. I went through a big adrenal thing. I think maybe you and I have had conversations about it. Maybe, I can't recall, or I probably shared with the group and you were in the group. But again, it's been a while, so I don't know how much I shared about it. But I went through a pretty bad, adrenals were shutting down. And shutting down, like I couldn't move and my hair was falling out in chunks and I was exhausted, but I couldn't sleep. My body was on fire. It hurt so bad. And my gums were throbbing, bleeding, like almost there was a short window of time where no brushing, no flossing, no nothing, just they would bleed. I mean, bad, not good. Everything I'm describing is, Donna, there's something really bad going on in your body, right? Like I could hear it loud and clear. So we've talked about bad breath. We've talked about bleeding gums. What if somebody who's not diagnosed with an adrenal issue like I had, although that could be the case, what if somebody's got pressure? What if their gums are throbbing? I mean, isn't this like a beacon, you've got a problem right now?
Yeah, exactly. And you want to work with dental professionals that understand the oral systemic link, because some don't. And it's, in dental school, we're taught a lot about the mouth and teeth, but 4 years of specific dental school just isn't enough time to cover how it relates to the rest of the body. So if you've got a problem like that, especially where it's like all around your mouth, we call it generalized, it's moving all over. It's not like you just have one specific spot. It could be more of a tooth. But, a lot of these cases, like you mentioned, is, well, what's the risk for other problems, right? Like we see a lot of people who have sensitive teeth and we find out they have a sleep disorder. Most people with sleep disorders are clenching or grinding their teeth in their sleep, and they may not even know it. And their significant other may not even know it. But that's going to cause sensitive teeth because your teeth are just being pounded. It's like not having a disc, a meniscus in your knee and going bone on bone, right? Chewing normal teeth can last years and years. I have 90-year-old patients. Their teeth aren't worn down at all. Your teeth are not supposed to just wear down. If your teeth are getting shorter and chipping and wearing down, you've got a major problem. It's going to tie into your gums. The other problem with it is, if you have smaller, worn, or chipping teeth, your mouth gets smaller. And the smaller your mouth is, the more likely you're going to have breathing, airway, sleep disorders. A lot of times we'll see this even in very fit and healthy people, right? We see a lot of female patients who are just very petite, small airway, normal sized tongue. They lie back, their tongue's blocking their airway. We call them silent snores. A lot of them don't even snore. A lot of these patients don't even snore, but they maybe had teeth out for braces, like 20, 30, 40, 50 years ago, there were a lot more teeth removed for straightening or retainers because there wasn't the technology we have now. And it causes their mouth to shrink, slows the breathing down, slows the airway. You have sinus and nasal issues, of course, as well. But as you move down into the gums, like in your example, when you have these other systemic issues, there can be so many hormonal changes. We also run into a lot of people who are being treated for, like, say, adrenal disorders, are taking all these medications. 80% of medications have dry mouth as a side effect. If you read the fine print, most physicians don't talk about it because they're not treating teeth. Pharmacists aren't treating teeth, but it causes drier mouth, which leaches the minerals out of your teeth because your saliva brings calcium back into your teeth constantly. Teeth are like sponges. When your mouth dries up, it leaches them out. It works in reverse. Now your saliva is actually pulling the calcium out of your teeth. And now all of a sudden you're wondering, why am I getting root canals and all these other issues? But the number one loss for tooth loss in adults is gum disease. And we have 5 levels. Gingivitis is the first one. That's reversible. That's bleeding gums, swelling, sensitivity. That one you can reverse. Once you hit level 2, now you have irreversible bone damage and gum damage. Now, you can still save your teeth in most cases if it's treated, okay? Level 2, level 3, level 4. Once you get to level 4, teeth start to get loose. Level 5, you have to have your teeth removed. There's no good option, including surgery, to save them. So if you're listening to this and you're like, I've had root canals, or I had this one tooth, it kept getting worked on. I lost it, now I need an implant. It probably had gum disease, which caused all these other problems, which may be why you lost your teeth. But you look at uncontrolled blood sugar levels, uncontrolled blood pressure levels. A lot of times we've brought people in taking care of their gum disease, and you can have it done non-surgically if you get it found early enough. And it's really cool because now all of a sudden you're changing the life. People are like, I just feel better. I don't have headaches anymore. I couldn't fight off infections because I had this chronic gum disease, a chronic infection, and antibiotics or anything else aren't going to take it away. You got to, incorporate that into your total health plan.
So again, I just added dry mouth, whether a side effect of a medication or not, dry mouth, period. So again, we're looking.
Or breathing, if you have sleep apnea or you're a mouth breather, you're going to dry your teeth out every single night.
Oh, so mouth breathing, AKA snoring, right?
Mm-hmm.
Okay. So I'm going to, again, repeat some of this back because it's so good. And gang, here's what I want you to hear. Any one of these signs, symptoms is in fact kind of tapping you on the shoulder and telling you, look, you could speed up your weight loss. Look, you could feel better. Look, you could lower the inflammation. Look, you could completely reduce or eliminate the risk of Alzheimer's, high blood pressure, diabetes, if you'll pay attention to these signs and their mouth signs. So bad breath, dry mouth. So again, if you ever have bad breath, your body is talking to you through your mouth. If you have dry mouth, what do we used to call it? Cotton mouth. Gosh, I have cotton mouth,
Yes.
right? Okay,
Yeah.
Your body's talking to you through your mouth. If you snore, mouth breathing, your body's talking to you through your mouth. Bleeding gums, throbbing gums, any type of gum disease. And the great news is if you catch it when it's new, that can be fixed. But as it moves on and now you've got gum damage, bone damage, it isn't just within your mouth, although within your mouth is a pretty important thing, but it isn't just within your mouth. What your body is saying to you via your mouth is tied to all this other systemic stuff that's going on. So let me come back to a couple of questions if I could. One, we actually had in the group, somebody said they've learned a lot about tongue scraping and want to know your opinion on before or after brushing.
I typically do it before. I think the most important part is doing it regularly. And I really find the morning tends to be the time where there's the most bacteria and stuff on your tongue that you want to get rid of, right? Because a lot of, it's kind of like antibacterial soap. There's a time and a place for it, but it's like, we don't need to kill the bugs and wash them down the drain. You don't need to shoot the horse and kill it and then, throw it in the street and run it over. It's overkill. All right. So with the tongue scrapers, we're not trying to kill everything. We're just removing that bad stuff and putting it somewhere else. Right. So I like the morning, but sometimes I'll do it at night too. Right. If you get what's called geographic tongue, which are like these spots or swirls on your tongue, it's a common occurrence. I have it, at least I used to have it. I think as I've gotten better at this stuff, I have it less because I'm probably having less inflammation. But geographic tongue, a lot of people are very sensitive to spicy foods. It's like salsas and those kind of things are really sensitive. So when you use the tongue scraper, you'll notice you'll taste foods better, which is pretty cool. But there was a study done actually in a hospital, and they took immunocompromised patients, so sick people, and they had them use a tongue scraper in the hospital. Keep in mind, hospitals and care centers do very little for oral care because most of those CNAs are so bogged down with just keeping people alive. There's not even a chance to get their teeth brushed. But they use tongue scrapers. and they had a third less cold and flu. So as winter's approaching, we're hitting cold and flu seasons, those tongue scrapers were shown to reduce dramatically the amount of cold and flu, because especially if you breathe through your mouth, all that bacteria is just sitting on that tongue like a sponge. So to that question, consistency, it's like flossing. Consistency is probably more important than the time of day, but if I take my preference, it's going to be morning.
Okay. And another question is, what's your opinion on fluoride?
Well, that's a good one. I like it. Hot topic. Yeah. So I think it's important to distinguish. There's fluoride in the water. Some cities have it, some cities don't. And then there's topical fluoride, very different. Okay. Fluoridated water in most cities has to be under 1 part per million. What that means is for every million drops of water that you're drinking, only one of those can be fluoridated. All right. Sometimes if people are in a rural area where they're drinking well water, they might have 4 or 6 drops per million. That's where people start to have problems where they'll notice like discoloring of teeth. All right. So most cities, I think like the city where I'm at, we're like 0.8 drops per million. Okay. But whether you like it or not, okay, there's good research showing that in the 50s and 60s, when tooth decay was going up, they added it to water, it went down a lot. Okay. Now, a lot of people are concerned, well, what are the other side effects? And, why do we have to have this in our water? Okay. A lot of us use filtered water. I use filtered water. You're probably not getting much of it anyway. Regardless, once you're about 12 to 16, all your adult teeth have grown in. That fluoridated water is not going to help your teeth one bit. Okay. Because you're done growing. That's such a small amount, I'm not going to notice. Okay. When you have it in toothpaste, for example, it's like 1,000 drops per million. Okay. It's much stronger, but it's safe because you're putting it on topically, spitting it out, leaving that film behind so your enamel soaks it in. That's the kind we really talk about with adults. And we put a varnish on our patients' teeth in the office. It's like 22,000 parts per million. So it's 26 times stronger than your toothpaste. If you have decay, receding gums, sensitivity, I would highly recommend you get this at the dentist. Again, you're not swallowing it, you're not ingesting it. That's where the controversy comes. This is topically applied. We use one that's xylitol, calcium, and fluoride. So you're getting kind of the triple wax on your teeth.
Okay, let's keep going on your points, because I know I interjected a ton and I stopped you. So let's jump back in with the rest of the stuff you want to make sure that we learned today.
So, one of them we touched a little bit on was xylitol. Okay, if you're not familiar with xylitol, it's a tree sugar. It can come from corn or trees. The better kind usually comes from trees, especially birch trees. It's called a sugar alcohol. What a sugar alcohol means is it's derived from sugar. Okay. So there is some there's some caloric value. There's some calories in xylitol, but it's like less than half of table sugar. Okay. The cool thing about xylitol is it turns off bad bacteria. Okay. So it's safe. It's not trying to kill it. It turns it off. It's like pushing the pause button. It's good for your nose, your nasal passages, your sinuses, and your mouth. Those are areas of the body that really can become a lot healthier with xylitol. So you can if you suffer with constant sinus issues, allergies, there's some really good xylitol sprays. There's one I'll use occasionally that, if I've got some stuffy nasal passage or something, and it's got like a grapeseed oil or grapefruit oil and some xylitol, and clears your sinus out. It's very safe. It doesn't have the side effects of all the ones with steroids and all these other things that will actually further contribute to dry mouth. If you use an inhaler, like for asthma, especially if you're using it regularly, those steroids just wreck teeth and cause dry mouth like crazy. I hate those things, but sometimes you got to use them. If you're using an inhaler occasionally, you probably don't have too much to worry about. But if you're using one weekly, it can really cause some problems. So xylitol, you make mints, candies, suckers, and it's really bad for dogs. Dogs can't digest it, so don't let your dogs get it. But great for kids, pregnant moms, nursing babies, totally fine. So, I'll give my kids a xylitol sucker. Tastes just as good as a regular one. It's less sticky too, but it's good for your teeth. It supercharges the minerals on your teeth. And if you have dry mouth, they make these cool discs that actually take like an hour to dissolve. So if we have someone who's maybe wearing a CPAP or an oral appliance for sleep apnea, or maybe they just have dry mouth, you can put this little disc, you can stick it like on your gums or the roof of your mouth. It dissolves very slowly. It's a nice minty or fruit flavor, releases some xylitol. And so that's really cool. You can get it for baking and cooking and other things like that
And
too.
you use it as a rinse when you wake up in the morning. It's like a
Yeah,
mouthwash.
there's rinses you can buy that have xylitol as one of the main ingredients. Yes. Mhm.
Okay, so
Yeah.
we're looking for basically a mouth rinse, a mouth wash with the key ingredient, one of the key ingredients being xylitol.
Yep.
Okay.
Yep, exactly.
I assume a
Yeah.
really great health food store that you're going to
Correct.
go to the right place to find that. Or
Yes,
obviously
yep.
the infamous Amazon probably has.
Yes, correct.
Well,
Yes,
isn't it?
exactly. But some of them you got to watch. I mean, part of the problem with a lot of rinses and a lot of the oral products, I mean, every time I'm at the store, which isn't that often because I hate shopping, if it could be sent to my house, all the better. Okay. But if I'm at the store, you go down the oral products aisle and it's overwhelming and there's way too much stuff. And I just want to stop people and go, hey, let me tell you, don't buy any of this crap down here. Okay. Here's the stuff you want, because there's so many preservatives added to those that are acidic, that can be counterproductive. So when you're getting a xylitol rinse, just because it has xylitol doesn't mean it's going to be great. All right. But you want to watch for stuff that doesn't have too much artificial ingredients in there, which kind of ties into the next point of acid. Okay. If you suffer with acid reflux, if you drink lots of citrus fruits, citrus drinks, citrus fruits, don't brush your teeth for 30 to 60 minutes after. Kind of the point we talked about earlier with water. But if you pour acid on something and then scrub it, right, you're going to take that coating or that film right off, which in our mouth is called enamel. Enamel is the hardest thing in our body. It's way harder than bone. All right. The inside of your teeth are like bone. The outside is like rock. It's way harder than bone. You want to protect that precious enamel, because teeth are one of the few tissues in our mouth we can't grow back, right? Skin can grow back, bones can grow back to some degree. Teeth can't grow back. So taking care of them is so critical. So when you have an acid attack, an acid challenge, drink some water, swish that around. I encourage people, if you go and have a meal and there's dessert, or, some kind of citrus drink or something, get some water too. And after you consume it, swish your mouth with water really well. Okay. And that will help buffer that acid off quicker. Or have some xylitol mint, xylitol candies, and those help a lot as well.
So let's do, you're giving us great examples for what to look for the xylitol rinse or the mints or the suckers or what have you. You mentioned water pick. Did you literally mean the brand water pick is what you recommend, or just the any device that does a good job shooting the water in between the teeth?
Yeah, Waterpik's a great brand. Philips Sonicare makes one called the AirFloss Pro. That one's pretty cool. You push a button, it shoots air and water, and you just hold it right at your gums. I mentioned I had braces as an adult. Half my lunch would get stuck in my braces every time I ate. So, my calories were cut in half just by having braces, because I wasn't even eating half the food, right? But that became my best friend, because it allowed me to get out. And if you have bridges, or you've had a lot of dental work, or you have crowns or gold caps, implants, they clean a lot of those hard to reach places that you can't get to. So there's a couple different brands. There's a new one, and I can't remember the name, but it actually will hook into your shower head. It's pretty cool. You can irrigate your mouth while you're in the shower. If that's not total body clean in the shower, I don't know what is.
That's awesome. That's incredible. Okay, so I do have another question. Well, I have two more questions, but I want to make sure that we've shown respect to the things you really wanted to share with us. Anything else on that list that you really want to make sure we know?
I think, the two other ones I want to cover was, if you have any clenching or grinding issues, you're going to want to get a mouth guard, a custom fit one. Okay. I'm not talking for treating sleep. I'm talking if your teeth are worn, chipping, you're clenching. Somewhere around 50% to 60% of adults clench their teeth and don't know it. But before you do that, you may want to get a sleep screening, because a lot of times that's a bigger issue. Okay. We want to make sure we're treating the problem, not just the symptom. So if you're clenching your teeth, we want to try to figure out, well, why? Okay. So we typically will have our patients see a sleep physician for a home sleep test. It measures your breathing, your oxygen, a whole bunch of stuff while you're asleep. And it's really, really fascinating what you can find out about yourself. You know, smart watches and things can do a little bit of this now, but you really want to get the full test. We have a new one that's really cool. It's this big giant ring. All right. It'd be like a $12 million diamond ring if there were a rock that size.
It's big. I hear you saying the ring is big. Yeah.
It's big, yes. But you know, you can wear that and it measures it, and one of our sleep docs can diagnose. So you want to figure that out, but you want to protect your teeth. Again, the more they wear down, the smaller your mouth gets, the more likely you're going to have problems with gagging at the dentist, because when your mouth gets smaller and your tongue's the same size, gagging, you lose teeth, your tongue will actually flatten out and get wider, more gagging, which means it's going to block your airway when you're asleep. And unfortunately, as adults, you know, things don't tighten up typically with age. So the back of our throat that's soft, it starts to sag a little bit. Okay. There are some new ways, laser rejuvenation and stuff, that sometimes can tighten that up, but you want to just maintain the size of mouth that you have and not let it shrink down by losing teeth. And then the other one was probiotics. So there are dental probiotics. That's a huge area of research. You may hear them called oral probiotics, but that can be a little confusing because there's also digestive probiotics that we take orally. This isn't the same thing. These are dental or teeth probiotics that promote good bacteria in your mouth, that can get rid of the bad bacteria as well as grow the good ones. My 11-year-old daughter, she was complaining that, you know, she was kind of self-conscious when she had bad breath. So I got her on a tongue scraper and a daily dental probiotic, and that really helped a lot. That's a lot of where the future of preventative dental care is going to probably go is, hey, you know, we can figure out who's suffering with bad breath, who gets lots of cavities, who's got gum disease, and customize some of the probiotics. So those were kind of the other points that I wanted to cover, and now you can shoot with some questions there.
Yeah. So here's a basic, again, going to feel so rudimentary, but what we've done here today, which I so hoped I so hoped for this. I so hoped this is what would happen. And I'm not shocked at all that you blew away my expectations. Not to mention you brought your own entertainment committee, because I had no idea you were this funny. So, you know, now I will just expect you to laugh every time we're at the meeting.
Hey, going to the dentist has to be the top 5 of people's boring list. You know, so like part of my mission is we got to change that up, make it a little fun.
So you bring your stand-up comedy act to the office.
Yeah.
Okay, so rudimentary. You've already exceeded our expectations for what we hoped for today, but here comes let me state, you've already exceeded the expectations. I think we've done a great job of driving home bacteria, dis-ease, slower metabolic rate, slower to lose weight, causing real issues, how your body will talk to you through your mouth. We've done a great job. I feel so good about all of that. Let's go back to as rudimentary as you can get with the right way to brush and or floss, the wrong way to brush and or floss. Now, I know we talked about pressure. You did a great job there. Is there anything else we need to know about the right way, which is going to take us in the direction we want to go, versus the wrong way, which is going to take us in the direction we don't want to go?
Yeah. So what I'll do, I'll share with you my personal routine. Okay. So we have a handout we give our patients. It's like, here's my personal routine that's kept me cavity free for 8 years and counting. Okay. And if that's too much personal information, this will be the time where you'll be shutting off your device, because I don't want to hear about guy's personal routine. Okay. But the point is, what I'll typically do when I wake up in the morning, tongue scraper, mouthwash. All right. In that order. So I'll use my tongue scraper, mouthwash. What I'm trying to do is get rid of some of that bad bacteria, that toxic stuff that's been hanging out there all night. Keep my mouth fresh, gives you a nice minty taste. Plus, now I'm putting some of that good bacteria in there with a mouth rinse that's promoted, with xylitol or something similar. Okay. Then, I kind of get up, prepare breakfast, all that stuff. That's maybe 20 minutes later, drink some water. After breakfast, usually about 30 or 60 minutes later, that's when I do brushing number 1 of the day. All right. And I'm using my electric brush, 2-minute timer, trying not to cheat it. Okay, trying to hold it like a pen. Okay, it's a little harder with an electric brush. You can do just as well with a manual brush, but it takes a lot more discipline. All right. So if you're like, hey, I love a manual brush, you can do it. But we did a research project in dental school, and we found manual brushes could do as well as electric brushes. The problem is most of us are a little impatient, me included, and we're not always putting a 2-minute timer on our phone or an hourglass. Okay.
Mhm.
So I like the electric brush for that reason. It'll start to change from a flat face, frowning to a flat to a smiley face as you get closer to 2 minutes. All right. Sometimes I'll do a middle brushing in the middle of the day. Okay. Sometimes your teeth just kind of feel a little bit filmy or gross. Maybe you had some starchy foods or something like that. So one of those, and then, I'm drinking water throughout the day, right? If I'm eating a meal that maybe has some carbs in it or some starches, even the healthier ones, they're eventually broken down to a simple sugar. So I'm rinsing that off with water. And then before bed, I floss first, brush second, and then I'm not eating, drinking, or rinsing for 20 minutes, leaving that film on my teeth. And when you talk to most dental hygienists, they've got little instruments at home and they're scaling and cleaning. So again, what I'm trying to convey is, what are things you can do that dental professionals do that you can use at home so you can avoid unnecessary trips to the dentist? But at the same time, you may want to schedule more frequent preventative visits, because sometimes 6 months is just too darn long when you're dealing with something, or when there's a fire that could have been put out. And that's really my routine. Now, the irrigator, like I said, when I had braces, I used it a lot. I don't use it as much now because I've got a kind of a system that I follow. But certainly, if I had like implants and bridges and really hard to reach areas, or a lot of people, if they develop arthritis, right, where they have a hard time reaching way to the back, the irrigators can really help in those areas.
I mean, look, you and I met, Tyler, through business, through marketing, having marketing in common. And look, you only have to know me, guys, for about a millisecond in marketing and business to know that one of the first words out of my mouth will be template. I want a template. Give me a template. Give me a template, and I am dangerous, right? I will let it teach me. I'll let it inspire me. I'll make it my own. Because when you have a template, you don't have to go through the research and development. You don't have to go through the learning. You just go to somebody who's already got the template. Okay, we were just given the template for putting your body at ease, giving you the template for letting your metabolic rate go faster and you'll lose weight quicker, giving you the template for sleeping more soundly, giving you the template for lowering your risk of Alzheimer's, high blood pressure, diabetes. And that was very simply wake up, do the tongue scraper, do the mouthwash, 20 minutes, drinking some water, brushing for 2, making sure that you've got water through the day, at nighttime, doing the flossing or the water pick routine, and ending with brushing. Like, this is gold, what we've just been given. One last question, and we'll close with this. Well, one last question, and then I'll also say, is there anything else I should have asked you? I didn't ask you anything else that's kind of popped up in your mind that you want to make sure you mention. Somebody has asked, what toothpaste? That's got to be like the classic dentist question, right? What toothpaste do you recommend? What should I be buying? And this was a double question. What toothpaste do you recommend? And if I already have receding gums, what should I be doing? So that's like a double from one.
Yeah, that's good. Well, so I'm just gonna make sure my do not disturb may have turned off. Let me make sure it doesn't. I don't want any calls coming through here. So yeah, like I mentioned earlier, every time I'm in the toothpaste aisle, I kind of want to like get a megaphone and be like, I can tell you're confused down there. Let me give you a hand, buddy. Okay. Because it's easy to get lost. Okay. So I look for toothpaste.
That's a great marketing video, by the way. You need to go to this. You need to do that.
Yeah, you're right. I need to. Yeah. All right. So if I get a picture of it or I get thrown out of the store, either way, I'll send it to you. We'll see what happens. All right. And then everybody will know where they can buy toothpaste, the one that I didn't get thrown out of. But so I'm looking for something that doesn't have a lot of preservatives in it, and something that has both xylitol and fluoride. Again, I'm a big fan of topical fluoride, safe, effective. The one I'm using right now has like aloe vera, fluoride, and xylitol in it. They do make a fluoride-free version. Okay, so if you don't want to have the fluoride, but again, topically, we found it to be very effective and safe. There is one that can be prescribed. Okay, you do have to have a prescription for this because it has extra fluoride in it, but it also has nanohydroxyapatite that comes from sea coral. So you can talk to your dentist about that. And that's another form of a special calcium molecule that helps desensitize your teeth. And you know, those have a neutral pH. So if you probably, there's a lot of talk of pH, but you want to find something that's neutral. No matter how much good stuff it has, if there's a whole bunch of preservatives and it makes the acidity go up, that's counterproductive on teeth. And that's unfortunately what a lot of products need to have a long shelf life. So that if you already have the receding gums, the other part of the question, right, was what if I already have receding gums?
Yes.
Just make sure you're massaging in small circles. Don't scrub your teeth. Okay. Like just take the word brush and kind of throw that out the window. Just think about massaging your gums. Okay. Your enamel's hard. It's going to clean very easily. It's up by the gum line where your teeth get softer and stickier. You just need to massage that. If you rub it too hard, you're going to cause more receding gums, which means more bad plaque sticking, harder to clean. There are some things, you know, you could talk with your dentist about. Sometimes we'll recommend a gum graft. That's where some of your natural gums are added back to bring it down. But we talk about stability. So if your gums are stable, meaning we're not having bleeding and increasing gum disease and, you know, terrible breath, but it's stable, we're keeping it stable, you probably don't need to do that. You just need to be very gentle on your maintenance. Gentle and frequent is much better than infrequent. You know, there was another business owner I was talking to. I remember him saying he got so sick of his hygienist hounding him about flossing. He started scheduling a checkup at another dentist across town 1 month before his regular one. And now he goes in there, hygienist is like, hey, well, I don't know what you're doing, but it's working great. All right. So if you want to go to those extremes, you certainly could. But again, he's kind of doing what I mentioned earlier. He's essentially getting 4 checkups a year instead of 2 by doing that. Because sometimes they're just places that are hard to reach or hard to clean if you have crowded teeth, you know. So do a little bit of those things at home every day, and it's almost like having a hygienist in your bathroom, checking your teeth before you go to bed, keeps things nice and clean.
Pretty great. So listen, when we were in school, we were all taught, right, that you brush down on the top teeth, you brush up from the bottom teeth. Is that still a thing, or is it more circular and more gentle? Which is better?
I mean, if I were cleaning windows, I would probably do that, you know, squeegee down from the top and up. But for teeth, I think more of the circles is better, a little more massaging, you know.
Okay.
But
And
those, you know,
go ahead. I'm sorry.
I was going to say, with a lot of the electric brushes, they either oscillate or they vibrate. So they're kind of handling that part for you. You don't even need to really move the brush. And that's where people can damage their teeth is if you got this motor that's moving and you're doing this, you can really beat up your gums. So gums like a little bit of stimulation, you know, it's just like our muscles. They want a little bit of stimulation. That's how they stay strong and get better. They just don't want too much. They don't want distress. And so with an electric brush, you just are just holding it. So you're going 30 seconds up here, 30 seconds here, 30 here, 30 here, you're done, right?
Yeah. And I know that you have said that if you want to prevent receding gums, obviously we're taking care of our teeth, but just don't push so hard, not so much pressure.
Right.
Yeah. I'll leave everybody, before I ask you the last question, I'll leave everybody with a little chuckle, and anybody who knows me won't be surprised by what I'm about to say. I do tend to have a bit of a driven personality. And my husband years ago bought us both electric toothbrushes, the rechargeable kind, right? And he would walk over to our vanities are on opposite sides of in our main house on opposite sides of our bathroom. And he would walk over to my side of the bathroom and he would pick this thing up and he would go, "What are you doing?" He's like, "What are you doing when you brush your teeth?" Because guys, the bristles on my toothbrush would be all gnarled and pushed down and like go in all these different directions. And he goes, "You're brushing your teeth too hard." Like, "You need to back off. I'm replacing the head on your brush like all the time." He goes, "Look at mine.
Right.
Looks like it's brand new." So
But hey, he could probably see his reflection in your teeth from 1,000
I'm
miles
a work
away.
in progress. I mean, more, less is more, right? We hear that all over the world. Less is more, less is more. All right. So is there anything you want to leave us with? Last words, sum it up. What do you think? Where are we at?
Just, take good care of your mouth. Like I said, most of the things you look at in the mirror every day in your mouth, they don't grow back. So take good care of them. Do what you got to do. Prevention isn't exciting. It's not sexy. It's not like, oh, I'm so excited about my preventative checkup at the dentist, right? It's very different than when you're getting veneers or teeth whitening. That you get excited about. But, a little bit goes a long way. It's just that idea of, a small hinge swings a big door, and just adjusting a couple things to your routine every day. You're not going to necessarily just come home and go like, oh, my teeth are transformed in a week. But 10 years from now, hopefully you'll be thanking Donna going, hey, I've still got all my teeth, or I still have most of my teeth. I'm happy about my smile because we had this conversation years ago.
Outstanding. So personal question. Are you going to be in Cleveland or are you not going?
No, I'm hoping to go next. I'm hoping to be there next year, but yeah, I've got a conflict. We're going to be in Costa Rica. I'm taking the kids to Costa Rica instead,
Oh, well, you're going to Costa Rica instead of Cleveland.
Yeah.
I didn't even understand.
Yeah.
It's just so confusing why you would make that.
Maybe I want to take them. I'm actually next year, I'm going to take my son. So each of my kids, when they're 15, I want to take them to a third world country on like a dental mission trip where you go like out in the sticks and you're just like, you're doing dental work with just rudimentary stuff, but it's such a like humbling, eye-opening experience.
Wow.
Of like just incredible gratitude when you're kind of overwhelmed, but you're like, man, my life's pretty dang good, no matter what problems I'm dealing with.
And that's a good way to end. All right, friend. Thank you with all my heart. This was outstanding.
Great.
If you want a copy of this, I'll absolutely get it to you right away. So
awesome.
You can use it.
Love it.
It'll bless you. You guys send in words so I can send them on to Tyler. This was outstanding. I know you loved it. You guys are going to want to go back to this link, watch it again. And like I told you in the video, you're going to want to share this with people that you love because this was great.
Yeah.
Great information.
Great. Yeah. I'd love a copy of the video. Love any feedback. And if you need a copy of my brushing template or anything, happy to share that as well. So.
All right. Thanks bunches.
Okay.
Have a great day.
Thanks.
Bye-bye.
All right, see you, Donna. Bye.